Taking that first step in deciding to have any kind of cosmetic surgery can be daunting. To help, there are patient coordinators like Dr. Dorothy Bitter, who walks patients through the process of what to expect before and after cosmetic surgery.
After I do the initial interview with the patient and we have identified what their real concerns are, then I take them on to Dr. Morrow, and Dr. Morrow does his professional interview. He does all the photography, goes over what their concerns are, their expectations, and what he thinks the outcomes will be for them. After Dr. Morrow brings the patient back to me and we discuss what their feelings were on their interviews, and then we talk about insurance coverage and the financial aspects. I also talk to them about their health, making sure that they are good and healthy. I coordinate all their testing, all the things that the surgeon requires that they want to make sure that they are physically strong and cleared for the surgery. I also go over their pharmacy prescriptions that they must have for this. I also go over approximately, I'm going to say 50 pages of what we need to do for them, what they need to do for us, their histories, their physical, their family histories. Sometimes this involves speaking to their family practitioner, their cardiologist, their internist. Then we set the surgery date. We plan where they're going to stay. We interview and discuss also with the family members who are going to be the caregiver for this patient, the expectations of what it is for that caregiver. Also when to arrive, what to do, what to wear, their post-op care, their aftercare when they go home. Also discussing with the patient's family what they're going to expect, what they need to expect. Very important with the family to coach and counsel them. I'm here for the day of surgery. I'm like the welcoming wagon. They get used to seeing me because I'm their support group. The family arrives, the patient arrives, and at that point we take the patient in to see all of their doctors, which includes the anesthesiologist that will be with them that day, their surgeon, Dr. Morrow, and also anyone else that will be with that patient. Frequently we have cardiologists that come here and are here during surgery with their patient. That's the care that the patient gets under the Morrow Institute and Dr. Morrow. It's very important for a patient to see and meet everyone before their surgery so there is no fear, that they know who their team is. So when their eyes are open or they're talking to someone, they already have built that relationship before they go into the operating room. In my 30 years in the industry, I have to tell you, I've never seen anyone that does post-op care like Dr. Morrow. The quality of the care that he gives that patient, it is like his own family. He believes in it and he treats them that way, and they feel that. I also think it absolutely adds to their recovery. They have, I feel that the patient has a much more positive recovery because they know Dr. Morrow is there for them. The other thing is when you come for your post-op care, we wash people's hair. We again spend quality time with them. We also have the VIP accommodation for patients here. Some patients feel anxiety about going home or not sure their family caretaker can handle any emergencies. We have the most beautiful rooms set up here with their own private patio, large spacious marble bathrooms, sinks, shampoo bowls, internet connections where they can do all their business here also while they're staying, 24-hour nursing for them. Makes them feel very comfortable and confident that in case anything, any emergency, that we're here for them. One of our protocols is that all the nursing staff that works here, they call the patient the day after also. They call them every day, up to at least 3 or 4 days. They also see Dr. Morrow every day through the course of their recovery until he feels it is not necessary anymore. All the bandage changes, all the aftercare is done here in this facility. Their pre-op, post-op, consultations, surgery is all done in this wonderful accredited facility.